All. This is Dr. Mobeen Sayed from DrBeen.com. Welcome to one more show. So this discussion today is very important. This is from the National Health Services of UK, plus some of the institutions from UK, plus some of the pediatric hospitals and universities associated with them, the doctors from there and professors from there. They have put this data together for UK's pediatric population, or the youngsters that are up to 18 years of age, lesser than 18 years of age. And the data that they have put together is the number of deaths and the death rate in the younger population if they become sick with COVID. So while we're going to look at the data in detail, and there is going to be a part of the data that I do not agree with, I want to give you a summary of what that data is and what is the takeaway as a parent or as someone who's curious about children's outcome. So the data shows that from March 1, 2020 till February 28, 2021, so almost 364 days or 365 days, 364, 1 year, there were about 500,000 children who got COVID, a total population of about 12 million under the age of 18 is in UK. So out of those 12 million, 500,000 became ill with COVID. Now, this is not an absolute number, because if you continue on with the time, there will be children who would still continue to become ill. So we cannot say that out of 12 million, this is it, 500,000 and we stop. So that is an area where I disagree with the authors. However, I have a feeling for why they did it. We'll talk about that later on. Let me just continue with the summary. Out of these 500,000 children who became ill with COVID, 25 died of COVID or because of COVID. That is the data. Out of these 25, 16 had terminal comorbidities or life-limiting comorbidities. Out of these 25, majority were Asians and Black children. Out of these 25, 6 children were totally healthy, did not have any comorbidities. All the remaining children had comorbidities. So this is the basic data. Now, what I do not know, and this is the data that maybe I did not look at the tables more carefully. What I do not know is that out of these 500,000, how many were healthy children without comorbidities? Because this number 6 who died should be looked at from the point of view of the total cases in that healthy group. So let's say I'm going to make up a number. So warning, number being made up. Let's say out of 500,000, 500,000, 400,000 were healthy children without any comorbidities. They got COVID. And out of those 400,000, 6 died. Then that is the ratio there. That is the percentage. On the other hand, let's say 100,000 had comorbidities, and out of those 100,000, 16 died. Then that is the ratio there. So this one piece of information is not available to me, and that may be just I did not look more thoroughly, and I'll look into that anyways. Second part of the data that is interesting for us to know is to compare it to adults. During the same time, so I had to go curate this data from other places, and I'll show you those links. During the same interval of time, in UK, about 3.6 million or about 3.7 million adults became ill with COVID. So there were about 4.some million total, and I removed the children's number from it. So about 3.7 million people became COVID positive. Out of them, 119,000 died. And once again, I removed these 25 from the total number. And the definition of death was dying within 28 days of being COVID positive. In case of the children, those 25 deaths were actually assessed to be because of COVID, not with COVID. There were actually 61 deaths of the children who were COVID positive. But looking at those 61 cases, they found out that 25 were because of the COVID and the other cases were not because of COVID. Now, continuing back to the summary, in case of adults, 3.7 million cases till February 28, 2021, and 119,000, about 120,000 deaths. So these numbers are drastically different. So this is one part of the summary. I'm going to show you, before we look at the data in more detail, I want to show you something else as well that is, again, for parents, it is a very important piece of information. So let's start. Here is DrBeen.com. So I am on Odyssey as well. I hope I'm pronouncing it correctly today. Odyssey, I asked my assistant to, to help me pronounce it. So Odyssey, so here we are. What I love about Odyssey is that they have pulled all the data from YouTube with chronological stamps. So there is correct date with every video. So you could actually see which video is recent and which one is older. And interestingly, these are the two videos that I recorded yesterday, and they have already been pulled. I didn't do anything. So either they have a trigger to pull them, or maybe somebody went and manually did it. I am grateful to them for doing this. Most of the time, I'm just reaching out to them saying, hey, I need this, and they are just doing it. This is a shout out to them for being so helpful. This is the BBC's article. And regardless of how you feel about BBC, I would like us to look at these doctors who were part of this study and their comments that are interesting. So here, lead researcher, Professor Russell Weiner. And let me flash the doctors here first. So somebody who comes up and says, well, this video seems like it is not a good video. It may be talking about vaccine and to take vaccine or not. This is England's National Health Services. So here, if you see Claire Smith, NHS England, then if you see University of Cardiff, Institute of Systems, Molecule and Integrative Biology, University of Liverpool. And if you continue to go down, you would see Imperial Colleges here, NHS England is here, NHS England is here again, Pediatric Intensive Care Unit, Bristol Royal Hospital is here. And if you see here, here is the lead, Russell Weiner, UCL Great Ormond Saint Institute of Child Health. Again, if I'm mispronouncing something, my apologies for that. Back here, Professor Russell Weiner said, it's a complex decision around vaccinating and shielding children required input from many sources, not just this work alone. But he said, if there were adequate vaccines, their research suggested certain groups of children could benefit from receiving COVID jabs. So the jabs, I would translate that into those who had comorbidities can benefit from vaccine. And then you can translate the rest, that who does he mean will not need. He added, I think from our data and in my entirely personal opinion, it would be very reasonable to vaccinate a number of groups we have studied who don't have a particularly high risk of death, but we do know that their risk of having severe illness and coming to intensive care while still low is higher than the general population. So this is about the comorbidities. Then there is one more comment here. This is from Dr. Elizabeth Whitaker from Royal College of Pediatrics and Child Health of Imperial College. She added, although this data covers up to February 2021, this hasn't changed recently with the Delta variant. We hope that this data will be reassuring for children and young people and their families. So I wanted to put this summary in front of us, and now I'm going to go over the data itself. Other references, these are all in the description. This is the adults and the cases and the number of deaths and so on. This is the paper itself. This is the PDF that you would also have the link to. This is the cumulative number of cases. So what I did was I wanted to see total cases in adults for the same duration of time. So I went up to Feb 28 here. These are the total cases, and then I subtracted the children's cases from it to extract the adults' cases. So this was one reference. The other reference is the worldometer. Once again, if you see here the total cases, the previous reference showed total deaths. So this was cumulative number of coronavirus deaths. Here, this is coronavirus cases. So once again, I went up to 28th of February, took this number and subtracted the children's number from it, and that gave me the adults number. So this is, you're looking at my homework as well. And now let's look at the data itself. I'm going to take these out just so that my processor does not churn too much. So here we are. So these are the gifts for the little humans. We have gotten the summary. So if you just wanted to have a summary, this much is sufficient. I am just going to go deeper dive in it. If you're a parent who has a child with comorbidities and you want to understand what comorbidities had more risk, we will talk about that a little later. So children and young, CYP, their definition was lesser than 18 years of age. The date was March 1st to Feb 28, 364 days. Data analyzed was for the deaths during this time of children. 25 total deaths occurred. That was 2 deaths per month was the rate. Now, another important thing to keep in mind is that they took the whole population of children of 12 million and used that in denominator to come up to say 2 deaths per million. Although that is not a very accurate way of looking at it, because all the 12 million have not gone through the COVID and finished. So, however, from an epidemiological point of view, we could say for 1 year's time, if you took this whole population and saw what would happen in 1 year, then this is what can happen in 1 year. If you give the same population another year, a similar repeat might occur. Now, comparing that to the adults, 10,701 deaths per month. So 2 deaths per month for children, 10,701 deaths per month for adults. Again, their populations are different. Total population, I think, is 67 million something. Adults are 56 million, children are 12 million. I'm rounding the numbers. So this is a number out of 56 million. This is a number which also has comorbidities and so on. So the numbers are not exactly 1-to-1, but still it gives you an idea of what is the risk for adults versus the children. And the death definition was death occurring after being positive and within 28 days of being positive. Now, here are the details. Population in 2020 was 67.9 million. 56 million adults, 12 million children, and children lesser than 18 years of age. So I made this comment before. It is not entirely accurate to divide the numbers by 12 million for children to say that is the final 2 per million. However, if you said 2 per million per year, then that may have been a more acceptable term compared to just saying 2 per million. Again, this is a preprint. I hope that authors would see those kind of feedback and fix those numbers. Here, let's now look at this number. It is simple. Please don't go over this more busy looking slide. I'm going to walk you through this. So let's start from the right side. Total cases in children observed were 469,282. I was rounding up to 5 million, but it is lesser, 470,000-ish. Out of these, and during the same period, there were 3,105 total deaths of children under the age of 18 in this 1 year. So that was about 250 deaths per 30 days. Important to note is that the COVID-related deaths were 73% in 10 years to 17 years. So lesser than 10 years of age, the number of deaths were very, very small. 61 had COVID positive and died. 25 died because of COVID. The remaining were not because of COVID, but when they died, they also had COVID. This is 2 per 30 days. Infection fatality rate. This is, I think, a better number than the overall population and the fatality rate from that. Infection fatality rate is that total infected were 469,000. Out of them, 25 died. So this is the number here, 5 per 100,000. And while this number is fresh in your mind, I want to compare that to adults. Adults were 32 per 100,000. So 5 versus 32. Or in case of children, the infection fatality rate, that means percentage of children dying out of the cases of the COVID, that was 0.005%. 0.005%. So what number can you keep in your mind? Out of 20,000 children who will become ill, 1 will die. That is the number, 21 out of 20,000. On the adults side, 1 out of 33. So out of 100 adults who will get COVID, 3.2 will die. So almost 1 out of every 33 patients. So once again, it's an important number. On the adults side, 1 person died for every 33 who got COVID. In children, 1 child died out of every 20,000. However, one more layer to understand this is, it is not necessary that out of every 20,000, 1 child has to die. It also has to be that their comorbidities are there. And unfortunately, just like in adult population, the old and comorbidity based population will become the victim first, and then more healthy people would be left. Similarly, it's not necessary that all 12 million children have similar comorbidities. So unfortunately, those children with the comorbidities might become the victims first. That means for parents who have children with comorbidities, you have to be more careful to make sure that either get them vaccinated or keep them protected more aggressively compared to the other healthy children. So this is a 640 times difference between adults and children death rate. Now, authors did one more, just a quick homework here. Data on the adult side, total cases were 4.16 million. I subtracted the children's cases, and the remaining cases for adults were 3.6 million. Total deaths were 122,849, out of which 3,105 were total deaths for the children. If you remove them, we are left with 119. I think that this number should actually just be 25. So you can say that 122-ish is the total number. That was about 10,000 every 30 days compared to 2 every 30 days on the children's side. Continuing on, this is also an important thing to keep in mind. So let me take a break for a second. important thing to note is, number one, there were 25 total deaths out of about 500,000 cases. Number two, out of those 25, 16 had already life-limiting comorbidities. Number three, a majority of the ones with the comorbidities had two comorbidities. Number four, majority of the ones with the comorbidities were Asian or Blacks. So that is the data to look at. Now, authors declared that with this data, what they are seeing is 25 deaths in 12 million cases. I'm repeating it so many times, I think you would recall it easier, and especially for those who have children. So please don't mind. So 25 out of 12 million. So authors said 2 per million of the population, and authors created a percentage of 0.0002%. I would have taken this number and added a time window with it. The reason for that is that this population is not done yet. Pandemic is not over yet. We could say UK is almost out of pandemic, but it is not over yet. So you cannot say that this 12 million population is done. Because of that, this treatment of the number is actually not correct. However, we can, for our cases, we just put 12 months with it to say, if you had 12 million children and you put them in a society where SARS-CoV-2 is, with the dynamics like UK, and you wait for a year, then out of those 12 million, 500,000 may get COVID, and out of those 500,000, 25 may die. So for every 12 million, there would be 2 deaths. So every million, there'll be 2 deaths. And if you repeat that for the next year, a similar outcome could be expected. Now, if we did a similar calculation for adults side, just to see comparatively the difference, adults had 120,000-ish deaths, correct? About 120,000 out of 56 million. So that is 2,138 or more deaths per million. So now please see this once more. 2,100 per million versus 2 per million. Again, this way of looking at the population and the numbers is not correct. But if in our mind we say within 1 year what will happen to this whole population and it would repeat, then this is what is the number. Now you know that it will actually not repeat. Why will it not repeat? Because in adults and in children, those who have comorbidities, those who are vulnerable, will become victims first. And then it will not repeat with the same percentages. The percentages will go down. And of course, you can add vaccination on top of it to say that would also start protecting. What I mean by this is, if you take UK's population and say, from today, we'll take and measure for a year once again, and this is the outcome expected, then that is not the case. We are not going to see another 4 million cases. We are not going to see another 120,000 deaths, and same case on the children's side as well. And no, don't bring up Delta variant with me for this one. Delta variant is not causing more deaths. So how about deaths per million of the cases? So cases, 33,262 deaths per million of the infections. So out of about 4 million infections, 120,000 deaths. So about 33,000 per million. Children, 50 per million. If we look at the infections, not the overall population. So this is different from authors 2 per million, it is 50 per million, but the number compared to adults are still very, very different. Secondly, the same thing I'm going to repeat. It's not necessary that every million from now on will have children with the same comorbidities that we saw in the first 500,000. So what is the most accurate number to keep in our mind? That is this. On the adult side, 1 death out of every 33 cases. On the children's side, 1 death out of every 20,000 cases. Case rate. So now the question that may be in your mind and that is not in the paper, and that is, what was the percentage of cases to occur out of the population, again, within this year? If we don't put a time window, we cannot really talk about it this way. So there were 3.7 million cases out of 56 million total population in this 1 year. So that is 6.6%. Out of this 6.6%, 3.2% died. On the children's side, 469,000 cases out of 12 million, that is 3.9% for the year. So 6.6% versus 3.9%. Here, 3.2% deaths. Here, 0.005% deaths. Some more details that are important to keep in mind. 72% of the children who died, they were more than 10 years of age and lesser than 18. So 10 to 17. That was 72%. No difference in sex of the child was observed. So girls versus boys, their percentages were same. Asians died more, 36%. Their case fatality was 16%. Blacks were the second more, 20%. Case fatality was 8%. This is important, and I'm going to read this out as well for the parents who are looking for comorbidities for their children and what is the risk. So I'll show that after reading this table out to you. Comorbidities, 19 children out of 25 had comorbidities, 1 or more. So 6 were actually completely healthy. So that is a 76% of the cases or the deaths were with comorbidities. 16 out of 25 had 2 comorbidities. So 64% of the children who died had 2 comorbidities. 60% had life-limiting conditions. 24%, that is 6, were totally healthy. 52% had neurological conditions. So looking at the comorbidities, which comorbidities were more involved? These were neurological. So 13 children out of 25 had neurological conditions. From this group of 13, 32%, that is 8 out of this 13, also had respiratory condition requiring oxygenation at home. So now I'm going to read you, this is a note from myself, I'm going to read you the list here which is important for parents, and that is the following. This will be page number, what is this page? Page number 6. So this is important. Amongst the 25 children who died of SARS-CoV-2, there was 1 child with each of the following comorbidities. So if this is a comorbidity that a child has, then parents, please be very, very vigilant. Congenital cardiac issues, oncological issues or cancers, hematological issues or blood disorders, obesity, endocrinology, and complications of prematurity. So these were the top comorbidities. Those children who had the following comorbidities that I'm going to read did not die. So even when they had the comorbidity, what are these? An isolated respiratory condition, cystic fibrosis, or asthma. So isolated means this only, not combined with cardiac condition or a cancer or some other condition, just this alone. cystic fibrosis, or asthma. 3 of the CYP with complex neurodisabilities had a historic diagnosis of asthma. However, the asthma diagnosis was not considered to contribute to death. Type 1 diabetes as a comorbidity was not a precondition or a risk factor for death. This is important. Trisomy 21 was not. Diagnosis of epilepsy was not. So this is important because when you hear congenital neurological conditions, you might think about epilepsy as well. So epilepsy was not a risk factor. Asthma was not a risk factor. Type 1 diabetes, which is also a very important comorbidity, was not a risk factor. So this is the discussion for today. I hope that it makes sense. And of course, as you saw that there were 3,100 cases of children dying. So out of them, 25 were because of COVID. The remaining were other reasons. So with this, I'm going to stop here. Please like, subscribe, and share. If you would like to support this work, there are links in the description as well to support this work. I will, if you don't mind, I will skip the chit chat today. My brother is arriving at the airport and I have to go pick him up. So although my wife said that she can go, but if you allow me, I'm going to see him after many years. So I would like to go and pick him up. So if this is okay, then I would see you tomorrow. Actually, tomorrow we'll have Dr. Antinatos with us and we'll discuss COVID management with him. So Rais Bhatt says, obesity versus COVID-19. Explain this in the next video. I have already talked about obesity in detail for what are the factors in obesity that predispose somebody to have a higher or more intense COVID-19. Please check it out. I did that about a year ago. Those factors are still the same factors. Lisbeth says, was there never a Delta variant? There is Delta variant, but the idea that somehow Delta variant is going to cause a lot of damage is yet not proven from the data. So John Snyder says July 19, the Great UK Experiment starts. So UK opens up fully on July 19. I think you are referencing that. I wish that everybody stays safe. Just quickly looking at the things here to see. Okay, cool. So here we are. Yes, so Yasin says, have you heard about the experiment of cure long haulers by injecting vaccines? That doesn't make sense to me. I know that there is a smaller percentage of long haulers that do respond to the vaccine. Others have not reported any benefit from it. Actually, many become long haulers after the vaccine as well. So I don't understand what is their reason for doing this. Dr. Z says, thank you for this discussion. It's going to be very helpful for parents considering the vaccine for their little ones. Absolutely. Absolutely. You're very welcome. William Goff says, have you seen the CDC updates on which comorbidities carry the most weight? I was shocked to see high cholesterol as number 2 and just barely under hypertension. No, I haven't seen it, but William, I'm going to look at that. That's a very important thing to look at. Skyfrog says, let us know how the airport is behaving. Will do. So once again, please like, subscribe, and share. If you would like to, I don't want to ask you to support this after talking about a grim topic. So just generally, if you would like to support it, there are ways to support this work as well. Thank you very much, and I would see you tomorrow.